So JC is a 41-year-old female with a current diagnosis of pancreatitis, and this is secondary to her diabetic medication. Additionally, the patient is currently experiencing nausea, vomiting, and diarrhea, dehydration, lethargy, and abdominal pain that radiates to her back. The patient has a previous medical history of type 2 diabetes, GERD, fibromyalgia, NASH, restless leg syndrome, asthma, high cholesterol, sleep apnea, and Sjögren's syndrome. The patient is 5'4", 229.9 pounds, and has a BMI of 39.3. There is no weight history for this patient, so we're unable to see if there's been any weight changes. The patient's most recent blood pressure is 120/77, and the patient has a elevated glucose, ALT, AST, and triglyceride levels. The patient has low BUN, albumin, and protein levels currently, and these could be contributed to the patient being dehydrated. Per H&P, the patient seems to be retaining some fluid. A CAT scan found that the patient has a fatty liver. The patient is currently taking sodium chloride for dehydration, Mirapex as insulin for her diabetes, hydrochloride, and Zofran. The patient was on a clear liquid diet, but has recently been placed back onto a diabetic diet with regular food. The patient reports having a poor appetite. The patient has a food allergy to sunflower seeds. There are no current history of what the patient is eating currently or really before admission, only that the patient was drinking 1 to 2 alcoholic drinks per week. When discharged, the patient will need to be on a diabetic and pancreatic diets. So for the nutrition diagnosis PES statement, it would be altered nutrition-related laboratory values related to organ dysfunction as evidenced by uncontrolled type 2 diabetes, hepatic dysfunction, which would be NASH, fatty liver, elevated glucose, ALT, AST, and triglyceride levels. So for our nutrition intervention, I will be using the Harvard Healthy Eating Plate as a baseline kind of guideline of how most meals should look. And I like this versus the regular MyPlate due to adding the water in for hydration and those healthy fats. So with this in mind, I will be wanting to look at this patient for pancreatic support, so low fat, easily digestible meals, small frequent meals, her diabetic management, so we want to control carbohydrate intake from complex sources. We want to look at her hydration and her protein, so we want to rehydrate slowly and monitor protein as her tolerance improves. And for appetite support, we want some nutrient-dense, lower fat options in smaller portions. So for some goals for this patient, it would be nice for her to consume 5 small, low-fat meals a day for 2 weeks post-discharge. Limit added sugar and processed carbs to less than 10% of total intake. Drink at least 1.5 to 2 liters of fluid per day unless retaining water or otherwise stated by the provider. And include a lean protein at least twice daily to support those current low albumin and protein levels. So looking culturally and at health equity, we want to keep in mind that Indian cuisine may include high-fat ingredients, so we want to recommend some culturally familiar low-fat alternatives for her. For health equity, as JC manages her multiple chronic illnesses, education must be accessible, culturally sensitive, and inclusive of religious or familiar food practices. We also would like to okay, and so how we want to manage, also want to look at language and respect, so using inclusive language and avoiding assumptions. So we want to consider any potential stigma around weight, diabetes, or food restrictions in Indian American communities. So for our nutrition monitoring, I'd like the patient to keep a 3-day food log to see exactly what the patient likes to eat and what changes she's attempted to make within her diet. So that would be keeping track of 2 days during the week and then 1 weekend day to get a well-rounded view. Also look at her lab values to see if there has been any improvement. Also want to have the patient keep track of water intake to ensure proper amount is consumed, especially if she starts developing some water retention. And also would like to see how the patient's doing, how she feels that any changes are sustainable or not, and what we can do to further increase her care.